any medical emergency.
You're deciding which insurance plan to purchase and want to know how much is it going to cost.
And services you want are covered by the plan you are considering. About how you want to balance upfront costs, like a premium, versus costs you pay at the time of care, like a...
Sometimes you pay money toward your health care. Sometimes the insurance company pays money. But when? To figure it all out, there are three main ideas you need to know: premiums, deductibles, and out-of-pocket maximum. It may sound complicated, but stay with us. It's not as hard to understand as you think. First, premiums. Think of your insurance as a monthly membership. Every month you pay the same amount in order to be a member. That amount is your premium. With your premium, say $200 a month, you get some preventive care for free. This includes care like vaccines and screening for diabetes, cholesterol, and breast cancer. This care is covered by your premium. But what if you pay? Then your insurance pays some and you pay some. And finally, your insurance pays everything. So how does this work? In the first stage, at the beginning of the year, you pay for most of your health care until you reach your deductible. Remember that your deductible is $500 bucket. Once you add enough to that bucket so that you pay your whole deductible, then everything changes. Then you enter into the second stage. Now every time you get health services, your insurance company will share the cost of those services. How much? That depends on your plan. Usually, you pay part of the cost, fees called co-pays or co-insurance, and your insurance pays the rest. But the second stage doesn't go on forever. If you reach a certain amount, you won't have to pay for any services. Remember that bucket? Every time you fill it with co-pays and co-insurance, your insurance company is keeping track. If you fill that bucket up to the top, everything changes again. You enter stage 3. From this point on, your insurance company pays everything for the rest of the year. That's right, every dollar of your health services paid by your insurance company. So what's at the top of that bucket? It's called your out-of-pocket maximum. This is the most money you will pay for your health care over an entire year. So let's say your out-of-pocket maximum is $2,000. After you pay your $500 deductible, and if you pay an additional $1,500 for various health services, you've hit your out-of-pocket maximum. From then on, you don't pay a penny more for covered healthcare services.
Next, let's talk about the different costs you will pay for health insurance. You will pay less to see providers that accept your health insurance. This is called in-network. You will pay more to see providers that do not accept your health insurance. This is called out-of-network. Many people who think they do not qualify for a subsidy actually do.
This is a list of doctors and hospitals that are connected to your plan. Insurance companies negotiate discounts with these providers. Stay in network and the discounts get passed to you. Go out of network and you could end up paying full price. In some plans like HMOs or EPOs, your insurance would pay nothing if you go out of network. In other plans, like PPOs, your insurance will cover you no matter where you go, but you'll pay a lot more if you go out of network. Sound easy enough? Well, sometimes staying in
Health insurance policy and provide the required details. The hospital team connects with the Bajaj Allianz claims team. The hospital sends the estimate bill along with the customer details via fax or email. Claim request is received by Bajaj Allianz and then verified. Once the claim is verified, the hospital is informed about the claim approval.
Healthcare claims can be expensive. With the introduction of ICD-10, tracking down problems like regulatory errors, utilization errors, procedure and diagnosis relatedness issues, and potential fraud, waste, and abuse conditions. Spotting these errors up front means that you can return the claim to the provider to correct. You save on admin and adjudication costs and improve payment accuracy. And over time, analyzing billions of actual claims
In the event of an emergency, do not hesitate and take your insured family member to the nearest hospital immediately for treatment. Once the patient's condition has been stabilized, you can then determine if the hospital is on the TPA network. If the hospital is a part of the TPA's network of hospitals, present your TPA ID card to the hospital. You will now be required
to fill in the pre-authorization form. This form has also got a section to be filled by the treating doctor as well as the hospital. Please ensure that this form is completely filled, signed and stamped. The completed pre-authorization has to be sent to your TPA within 24 hours of admission. Your TPA will review the pre-authorization form for its completeness
and eligibility under your insurance plan.
Following which, they will send an authorization letter to you and the hospital. At the time of discharge, please inform the TPA call center. In most cases, the hospital will do this, but it will help expedite the process if you do it as well. The hospital will give you the final bill and additional documents. Please review all documents and bills in detail and sign on all the pages. These documents have to be kept at the hospital itself. Do not take the originals with you. You can ask the hospital for copies of all the bills and once cleared, you can return home hassle-free. If it's a hospital that is not on the TPA network, you must pay all your bills before seeking reimbursement as per your coverage. It is imperative you intimate the claim to the TPA within 24 hours of admission in the case. All claims must be submitted within 15 days of discharge. If there are missing documents, the TPA will contact you directly, only if you have provided your mobile number and email address. The TPA will attempt to contact you 3 times on different dates. If there is no response, the TPA can reject the entire claim if the documents required are mandatory or for the amount that the required documents are missing. If everything is in order, you can expect to receive your reimbursement in due course.
The claim is now approved. But what if she gets admitted to a non-network hospital? No worries. All she needs to do is collate all the necessary bills and submit it at the Bajaj Allianz office. Once the claim is approved, she gets reimbursement for the expenses.